Ideal candidates for egg donation are patients who have a diminished capacity to produce good quality eggs. And that's typically women who are in their maybe early to mid 40s, but there can also be younger patients who may have gone through treatments like in vitro fertilization before, but demonstrate a poor ability to respond successfully to the medications. Patients who are looking for donor eggs, one of the things they usually want to do is find a donor that matches their physical characteristics, so matches their appearance, so the baby looks like them. But I also tell my patients that once they can do that the important things to me as a physician are, number one, to find somebody who's young, and young I mean maybe they're early to mid-20s. Number two, to have somebody who has regular menstrual periods. And number three, locally, ideally. Patients can find donors all over the country, and that's fine. I just would prefer to have the donor be local so we can do the monitoring ourselves. Patients can find donors either what we call a known donor, someone they know. Most people find anonymous donors usually through donor agencies, of which we help the patients locate. And also when my patients go to the agencies and find the donors, they can sometimes be confused about this donor is 22, this one's 26. So I have them call me when they've narrowed it down to help them potentially completely navigate through the rest of that process. I mean, the benefits to using an egg donor are to circumvent all those problems that are associated with poor quality eggs. And the problems are a diminished capacity to get pregnant, but also an increased risk of miscarriage. The success rate with using an egg donor is typically about a 70% chance of conceiving per cycle attempted. So there should be about 2 attempts at conception with the stimulation of one egg donor. And hopefully there's a pregnancy the first cycle, and the chance is about 70%, and the additional embryos can be used hopefully for baby number 2 sometime down the road. There's also the option out there for what we call embryo adoption. And egg donation can be kind of expensive by paying agency fees, the donor fees, and our fees for the cycle. When someone adopts an embryo, that diminishes the cost of the cycle pretty significantly. And so what happens is that there are patients who have undergone in vitro fertilization cycles and have achieved pregnancy and have extra embryos that they've cryopreserved or frozen, and they've decided they've completed their family. And some couples have elected to donate their embryos, which is fantastic. The difference with egg donation and embryo adoption is that with egg donation, there's the partner's sperm, so there's a genetic component there to the child. With embryo donation, there's neither person's genetics there, but the nice thing is they still have a very successful chance of achieving pregnancy, and so it's just a nice alternative in couples that don't have good quality eggs or are candidates for in vitro fertilization, but they don't have the finances for that.